A 12-month-old child is brought to your office because barky cough. The mother states that over the past 3 days, the child has developed a runny nose, fever, and cough. The symptoms are getting worse, and the child seems to have difficulty breathing. He sounds like a seal when he coughs. What is your most likely diagnosis? Okay? So, the patient will sound like this. That's what the cough sounds like, okay? Let's see if this helps. Oh, this is plugged in here, so that one. Yep, barky cough. Very good. All right. So, what does that make you think of for the first set of chocolates? Croup, Jonas, first one on there. He's a fast typist. Croup, very good. Rec, not pertussis. Croup. We'll do pertussis later, okay? Because this is not just visual. You get to hear all kinds of sound effects, all right? So it's croup. It's not, the diagnosis is not a virus, Pawan. The diagnosis is croup. It can be caused by parainfluenza virus, okay? But the actual diagnosis is croup. So, oh my gosh, I didn't even realize that. I forgot, my bad. The bronchiolitis is not the right answer. Bronchiolitis causes more of a congested cough. Epiglottitis really does not give a barky cough. And we're going to talk about all these in this chapter, okay? So let's get started. So croup is a subglottic inflammation, okay? It is most commonly seen at around 3 to 6 months of age, up to about 5 to 6 years of age. When you or I get a virus like parainfluenza, which is the most common cause of croup, although RSV, any of the viruses can do this, any of the respirators can do this. If you or I get that virus, we typically get maybe a laryngitis. And so we might get a sore throat, maybe a little hoarseness. But children, since their airways are smaller, they get a little bit more edema, okay, and they have that sound. So they might have a barky cough. They also might develop inspiratory stridor, like that, okay? So I don't know what to do about the voice because it might be your computer, okay? Might be your computer, I don't know. So it starts out with it starts out as a cold, 2 or 3 days of cold symptoms, maybe low-grade fever, and then they start developing this barky cough, okay? And they'll have a hoarseness. It's a very self-limited disease. You know, on the exam, on the exam, they always like to ask about best test, first test, things like that. Well, for croup, there is no best test. It is a clinical diagnosis. Okay? Croup is a clinical diagnosis. Let's see what we got over here. All right. You can do an X-ray, and there you have on the picture what's known as the steeple sign. You don't need to get an X-ray. It is not necessary, okay? But they will describe a steeple sign, or they might actually show you the treatment. The next best step would be treating it. Exactly. So if you're given a question like that vignette, and it doesn't say what's your most likely diagnosis, but it would say, what is your next step in the management of this patient? Okay, so there are various things that you can do. If the patient has moderate to severe croup with tugging and all, the next step would be to give an aerosolized racemic epinephrine. Okay? Aerosolized racemic epinephrine. It helps with vasoconstriction. The patients sound better. But you have to be careful about rebound. So you need to observe that patient, because when it wears off, you can get swelling again. Oral steroids are also indicated. Now, don't forget, this is for, especially for step 3, no extra charge, okay? It depends on your setting. If you're in the emergency department, go ahead and give that aerosolized, if depending on the degree of distress. Dexamethasone is the steroid of choice. Dexamethasone. It can be given either intramuscularly or by mouth. Okay? So you don't need to get x-rays. You don't get any studies. You treat Croup. That was the next best step. Okay? Okay, Alexia, it's a clinical diagnosis. The x-ray classically shows the steeple sign. It is not necessary to make the diagnosis. So the next thing to do, if they are in moderate or severe distress, give an aerosolized racemic epinephrine and follow up with steroids. The epinephrine, it works as a decongestant. It causes vasoconstriction. So it helps with the swelling. Kind of like when you use vasoconstrictors for a stuffy nose. It works the same way. Okay? All right.